Hi, my name is Naomi Lopez, and I'm Director of Healthcare Policy at the Goldwater Institute. Some members of Congress are eyeing a further Medicaid expansion for states that have not yet expanded under the Affordable Care Act. They're looking to sweeten the pot, basically throw in some extra federal money to entice those non-expansion states to do so right now. But this is a really perilous prescription for both taxpayers as well as the most vulnerable who are on Medicaid. That's because under the traditional Medicaid program, the state spends roughly $1 for every dollar that the federal government spends. But under Medicaid expansion, the federal government spends about 90 cents for every dollar that the state spends, and what's being proposed is to sweeten the pot even further for non-Medicaid expansion states to have the federal government basically pick up the entire tab for about the next 3 years. What is going to happen, though, is because there is a budget crisis at the federal level, as well as will soon be at the state levels across the country, where states are required to balance their budgets, states will actually have an incentive to cut services for the most vulnerable because they're not getting as much federal money for every dollar that the state puts in there. This puts the most vulnerable at the end of the line for healthcare services whenever they need it. Rather than focusing attention on ways to just throw more money into this government program, we should be looking at ways to make healthcare more accessible and affordable. One step is the White House proposal to use some of the money from the $100 billion fund from the latest stimulus package to pay for the needed medical care for uninsured COVID-19 patients. That's at least one step in the right direction, as well as the many proposals that the Goldwater Institute has worked on over the years that increase patient access and affordability. Thank you for your continued interest in the Goldwater Institute's dedicated coverage to the COVID-19 crisis.